All right. Hello, and thanks for joining the next data strategy webinar. Today, we have a great and informative session on the importance of having a well thought out data strategy, covering steps to achieving a sound strategy, and of course, a special interview discussion with our longtime client and friend from Children's Hospital Association. A few notes before we get started. This session is being recorded, and the recording, as well as any additional resources, will be emailed to you in the next day or so. Additionally, we will be launching a few polls during this session, and we encourage any feedback or engagement on those polls to help today's presentation tailor to your interests and needs, because we definitely want this to be an informative and beneficial session for you. Lastly, we encourage you to utilize the chat or questions window found at the bottom right of your Zoom screen to pose any questions you may have during the session. We will address these towards the end of today. And a few introductions. My name is Rachel Mason. I'm the marketing specialist here at Technion Data Solutions, helping out with this series. And Technion is happy to be hosting this series, the strategy series, as well as 3 other series in data science, visual analytics with our Tableau Zen Masters, and a data pipeline series. So be sure to check out upcoming sessions that we have throughout the end of the year. And with that, I'm going to pass it off to Teknion's Managing Director of Client Success, who also leads up our healthcare vertical here at Teknion Data Solutions, Will Gray.
Thank you so much, Rachel, and everybody. I'm glad you can make it, and good afternoon or good morning if you're still on the West Coast. Really excited today to talk about data strategy and how it can help you deliver better data, better insights, and better results. The real highlight of this is the interview we're going to go through with Lori, and just kind of seeing how she approached bringing in a data strategy to her organization, Children's Hospital Association. But before we get started, I'd like to just walk through the agenda of, we're going to go through some introductions and then cover a little bit about who Technion is. I know there's several of our friends and clients on the call who already know who we are, but there's some new faces as well. And so really excited to share about who we are and what we do and why we do that. And then I want to cover quickly what is strategy, because it can be a confusing topic, how one should approach that strategy, and then what we're all here for is learning more from Lori about how she brought data strategy into CHA to take that to the next level. So who is Technion? We are data experts at heart. We really focus in 2 primary areas: leveraging automation and enabling self-service. And we bring data into the organizations to do that and to help those organizations achieve their overall strategy and be able to position data the right way. Our consultants, they have really 3 things that they're focused around. It's 1, having a servant's heart and being there to serve our clients and helping them achieve their goals. They're always asking that next question and trying to see several steps ahead and asking those things. And they have a chip on their shoulder in a good way, with a humble confidence and knowing that they are really good practitioners and knowing when they may not have the answers, but knowing the questions to ask to get those. Very proud of our team. Our mission is we believe in serving others by helping them unlock the hidden truths buried in their data. And on the right, we have been extremely blessed with some amazing clients. And we exist to give back both into our community and helping those who are underprivileged and bringing data solutions to them as well. It's really why we're here. And so we really believe in doing the unexpected. And it continues to be a big part of who Technion is and at our core. So why is strategy important? And several of you probably have seen this slide before in this quote. It was Gartner in May 2019. But analytics projects fail, and they fail really fast. I'm sure many of you have been part of a project that did not go the right way or did not achieve the goals that they wanted, or it promised over-optimistic features, but the underlying processes were not there and not in place, or it did everything it promised, but it didn't help you achieve, at the end of the day, the win that you were trying to, because you didn't know what direction you were pointed in. And so before undertaking any projects, it's first always a good process to ask, what is our strategy? What are we trying to achieve? The problem with strategy is it can be very confusing. It is, at the end of the day, you look at what the definition of strategy is, and you're going to get a million different answers. And you Google it, or you ask yourself what it is, and you come up short every time. And it even comes clear, unless you are trying to achieve peace or war as a country, you look at definition number 2 from Webster, a careful plan or method. I know as you look at that, it's important to really think, okay, I am careful and I am clever, but how do I, at the end of the day, do I achieve that goal that I need? And more times than not, you see a good strategy once it's been executed. It's really hard to create that strategy and put it into place. And so I really like Michael Porter's HBR article on strategy and identifying what it is and what it isn't, and what it is not. And so, clear strategy offers a unique value proposition. You're the other kind of identifier in a good strategy is a clear trade-off. I'm giving up one thing to gain something else. And at the base level, we see this in chess, right? I'm going to sacrifice a pawn so I can gain an advantage on the board against a queen, or against another opponent's piece. And that may be 2 or 3 steps down. And so it does involve sacrifice in a lot of ways. We're giving up something. You see oftentimes that a good strategy, it fits together and reinforces other strategies that may be on the table, or it helps build up the rest of the team that's around trying to do that. And there's usually some evaluation or continual improvement that helps you realize that strategy. For how vague that can be, it really, what it is not is, it makes it a lot clearer. It's not going out and buying the first technology that you get pitched, right? It's not grabbing that cool data visualization tool, buying it and not knowing what to do with it. It's a lot of times we're seeing this in the data governance space. The strategy is just labeled data governance because it's the hot topic. And so they go, we see clients that go out and just buy a data catalog tool or a data glossary tool, and then it ends up becoming shelfware, or it ends up inhibiting the organization because there's not clear processes defined and that goal is not in place to achieve that. It's not downsizing. Downsizing might be a strategy, or it might be a component to get you to achieve your strategy and end goal, but it's not just downsizing. Execution agility, you can go down the list, but it's important when you're looking at strategy, and as we go through this interview coming up, really understanding, well, what is the strategy, what it is not, and why was obviously Children's Hospital Association successful in implementing the strategy at the end of the day that you're going to hear about. We oftentimes begin with the end in mind, and we see the world through a maturity of organizations. And while this is not a strategy to say, hey, I'm going to achieve pervasive, you should look through what is the goal and what am I trying to achieve and why I'm trying to do that, and where on my data path and maturity do I need to be to execute that. And oftentimes that helps you create that roadmap to do that. In fact, right now, Rachel is going to be posting a poll asking you about where you think you are at maturity wise in your organization. And so I would ask you to please do that as a point of reflection, and something that we can help follow up with you on to discuss further or help you identify where you might be. But we oftentimes see organizations many times not unaware, or else you wouldn't be attending these webinars, but in that tactical zone emerging. And then most of the times it's always nice to hit pervasive, but most goals are often accomplished in this level 4, having those trusted access to data. But again, the maturity model is not a strategy, it's something to overlay with that to achieve it. And so how do we help? And you can look at this and think, okay, do I need a third party to come in and help with data strategy overall, or is this something we can do in-house? And we oftentimes see both. For us, we're oftentimes brought in to affirm somebody's strategy or strategic vision, or to challenge that strategic vision in a way that ultimately builds credibility and sharpens and hones that end goal to being achieved. And so when we come into organizations, and you're going to hear this in the interview, we look at 5 different aspects of what that is. We look at people and process, the data models and structures, the architecture, how the data is being shared and delivered to the end consumer, and then advanced analytics. The how, it's really a 4-step process. It's really taking the time to step back, ask all the tough questions, interview all the stakeholders and bring that together to understand how does that meet those 5 steps, taking the time to digest and analyze it, and then developing recommendations to hit the goal. And then getting clearly defined readout to the end users to help achieve that. The readout, it covers the current state, desired state, gap analysis, and roadmap. And from a high level, I think that helps kind of define where we need to go. I'm going to stop sharing and introduce Lori Hotzel from Children's Hospital Association, and we're very excited to have her on board for this call. You know, she has undertaken a revisioning of CHA's data strategy, and you know, they're based in Kansas City, and so I just want to welcome her and thank you, Lori, for joining us.
Thanks, Will. It's great to be here. I really appreciate the opportunity to share kind of our CHA data transformation story or journey, if you will, and hope others can learn from it.
Well, before you dive into to what you tried doing with what you accomplished at CHA, could you give us a little bit of background about CHA and then the mission and maybe your role there?
Sure. So first of all, we are a complex organization, but our mission is pretty simple. We work with our hospitals as champions of children's health with a pretty strong focus on improving delivery of care. And we do that in multiple ways. We do that through analytics, research, quality of care, education. We have over 65 different programs and products that we work with our children's hospitals to help improving that delivery of care. Currently, we have about 220, maybe a little over 220 children's hospitals that we work with in the US. And we also have an advocacy and policy arm in our office in Washington, DC. They were very helpful this year in securing relief funds for our hospitals due to the COVID crisis. A little bit about me. So I've been with CHA for 3.5+ years. I lead the IT department here. Prior to that, I worked for a large private for-profit organization. They were similar in size to a Fortune 100 company.
I think that's one of the unique things that you really bring to the table is you've worked in almost all sectors, and I've really enjoyed getting to hear your stories behind the scenes. You know, working in a for-profit business, you worked in local government, and then you've also worked in nonprofit now, and so helping take and combine those learnings together and advancing CHA's mission at the end of the day. And here at Technion, we love that mission and enjoy your team, and getting to work alongside them to help achieve that better data, better insights, and better results. You know, I now want to dig into how you realized to start with strategy when you took on this data analytics program, and how you took that to the next level. What were some of the challenges and indicators you saw within the organization that led to you stepping back and ensuring you had the right strategy before you really dived into your initiatives?
So really, it kind of started out when I started at CHA. The analytics business lead had a vision of taking and wanting to take their analytics to the next level with some new data visualization capabilities and wanting to get data to our customers faster than we do today. Today, it's kind of a quarterly basis. So really, in order to see trends, you need to kind of get that data out there to them quicker. This was a great vision, and I was really excited when I started to see that they did have that vision coming into CHA based on my background and knowledge and things that I put in place before. But I quickly realized our data infrastructure was pretty dated and probably wouldn't play nice with the new data visualization tools, as you can imagine. That's really where our journey began, and defining a new data warehouse strategy was key.
I really love that word journey, because it truly is a journey, and it's not something that can be achieved overnight. And taking a step back and realizing, okay, we have to, you looked down the road a few steps and realized, okay, we can't get there with our current infrastructure. How do we achieve this? How do we do this through the nonprofit lens? To help you develop that strategy, you partnered with us, and we're very grateful for that. What were some of the deciding factors of bringing in a third party and leveraging the tool like the SDA to help you define that strategy?
So we really recognized we had gaps in knowledge on the IT as well as on the business side, which is our data owners. So I knew we were going to need assistance in really putting together what I would call a true transformation build out of our new technology foundation that would work with our visualization tool, be secured, flexible, and very high performing in delivering the data to our customers. Moving to the cloud was a bit of a barrier in the past for CHA just because of concerns around security. We house a ton of sensitive data for our hospitals. So bringing in a third party to kind of help bridge that level of knowledge around security and alleviate those fears was another thing we thought about. But also, sometimes hearing from a vendor that's been there, done that, a little tried and true can make a huge impact on gaining buy-in. And we knew we were going to need that going into this. The SDA also helped in bringing all the parties to the table and defining a more detail of our gaps and our needs and where we wanted to go with the future and our outcomes. But the part I liked the best about the SDA was the technology stack that the process kind of drove. It was defined in a way that we could be flexible and scalable. We didn't have to go big bang out of the gate, and we could introduce new technology as we grow. And as you can imagine, with a not-for-profit, making sure we're not tapping into our pocketbook that hard and heavy from the get-go makes a huge difference.
No, and I love that, and I love the intentionality. And being a father, our children have been to a children's hospital here locally in Dallas, and just seeing the sensitive and care that you've taken with PHI and PII data, and how intentional you are in making sure you make the right steps around security, and how that's kind of at the core, really makes me feel good. And it's the same intentionality we look at when trying to bring these solutions together, and ultimately finding the right stack that cohesively work together to help achieve that goal. Was really a fun process and exciting, and at times kind of stressful when trying to make sure it worked with your business and culture. Earlier we covered several different parts of our SDA: people and process, data models and structure, architecture and platform, reporting, and then advanced or predictive analytics. Were there one or two areas that CHA you really felt like we should dive in more based upon where you were wanting to take your organization?
Yeah, definitely the data architecture was where we needed a lot of knowledge, and we knew we needed to set that right from the get-go, mostly because of the data integrity and the security side of it. So that really needed to be a key focus for us. But the other thing of what I didn't know at the time that we started all of this is you and your team got to know us really well, got to know our data. So then we were also able to tap into some of your Zen masters to help us with some of our first Tableau dashboards. And there were some other engagements that we did with you kind of down the road, but just because Technion had such a bench of knowledge in areas where we had gaps. So kind of were a one-stop shop for us for a little bit when we first got started.
Oh, and we really appreciate that. And I know our team really enjoyed working alongside your folks, and I think several of them are on the call. So, hey, friends. But you just see people passionate about why they're there and helping achieve y'all's mission. And our team really enjoyed getting them up. And you do have a team of rock stars, and so it's very easy to get them onto the new stack and teach them best practices. And now looking back and seeing how far you've come in just 2 years is pretty amazing. And that's credit to your strategy, and hopefully our SDA helped play a little bit of a part in that. Every client wants to dive deeper into one or two of those areas as far as their maturity and appetite. If I'm right, we interviewed about 15 people at CHA as part of that process, and we're able to capture some really good information about your organization, but also where the challenges and roadblocks and opportunities lay for taking that organization to the next level. What were one or two takeaways from the assessment that really resonated with you and your team?
So being in technology, of course, we always want to focus on the technology first. But really, the takeaway was don't just focus on the tools as a starting point. Really think about the strategy and the outcomes you want to achieve. I think this really helped us to know what tools we needed to put in place first. Again, when you're thinking from a financial component as well, you want to make sure that you're putting in tools that you're going to use, not tools that you're just going to put there and they're going to sit and not take advantage of, and then annual maintenance comes and you're paying out of pocket again. So again, really focusing on what your outcomes are. We're also going so fast all the time, especially in IT, and things change so quickly, that we often forget about the change management component and ensuring we have buy-in from all stakeholders. So I felt like the SDA, like you mentioned, brought 15 people to the table, and really made us face some of those challenges head on related to the change management side and kind of where they wanted to go, that we might have missed had we not gone through the process.
And I think that's so true. I want to pivot a little bit because you talked about execution. And while this is a strategy webinar, I think strategy informs that execution, and the stack we put together really allowed it to, I think, scale beyond where you originally were wanting to point. And so I think there's a lot of different possibilities out there. But when we focus about how we ensured that the data was right, we built trust in the data, we got some early wins. Could you give us some thoughts on how you laid out that execution plan, and maybe a little bit of the why behind it?
Sure. So the first part, kind of as you mentioned, we really needed to get our data right. We have stakeholders in our organization that have spent years and years, really getting our data to a trusted state. And we wanted to make sure we didn't compromise that trust in a new environment. So I knew we'd have to continue to make sure that was a priority and focus on the trust of the data and the components. But if you don't focus on that, then the rest doesn't matter, right? It doesn't matter that you've got technology up and running if people don't trust in the data. So that had to be a first focus. The second part came a little fast and furious, faster than we thought. But the good news was, because we spent so much time up front, our analytics business leader was very confident in the technology and created a new initiative to move data processing, which was previously done by a third party, to us processing it in-house. Which is a lot of data that we run through our system on a quarterly basis, as I mentioned, and soon to be monthly. So we were going to do a smaller proof of concept to start. Obviously, that's where you want to start and make sure it's right. But we had some financial drivers that really moved this to the top of our list to focus on. And again, the SDA really helped in informing that plan. Through what I call kind of go slow to go fast. So we spent a lot of time up front coming up with a strategy, what our methods were, what our outcomes were. And so because we spent so much time on that up front, we were able to gain buy-in on doing such a large initiative out of the gate. So it really allowed us to move very quickly through the implementation phase for something that level of initiative. The third part is around how we move from our old analytics to our new platform. So again, we wanted to make sure that the platform was flexible enough that we could do that, because we've spent years building out these reports, and not everything makes sense to go into a data visualization tool, and it's a bit of a paradigm shift that you really want to think about. So again, the plan has really made it to where we can evolve and move things as we need to and want to in the new environment while maintaining our current customer base.
No, I love that, and it's been great to watch that execution unfold and how the organization's matured and the capabilities throughout that, and just seeing your team come along and build some really neat dashboards and analytical workflows, and really just take the work that we helped with and just take it to the next level and continue just to mature as a data delivery organization. I think you have a lot to be proud of. And one of those was recognized at the Snowflake conference last year, where you were nominated, I think, for some of the success, and it was your first year using Snowflake. And so Organizations measure success in different ways. Can you share with the audience a couple of the successes that resulted from the SDA and the journey CHA has been on?
Yeah, sure. While we saw some gaps in the knowledge going into this, I have, and you mentioned this, a great, very smart database team that has been able to execute on our plans and initiatives very quickly. And this was new to them, but again, as you mentioned, we've been able to do this in 2 years, and it's been a lot in a short amount of time. So just as a reminder, having very smart and capable staff is really key to all of this as well. But overall, related to the SDA process, it set us up for success because we took the time to lay out the strategy, and then the results really drove more than we were expecting. Not only improved data processing, but it created a better user experience for our data submission from our hospitals. They really love how easy it is, how they can follow it through the process, and basically can then just walk away. This also set us up to move to the monthly. I think I mentioned we wanted to get data out to our customers quicker, so it allowed us to move monthly data refreshes versus quarterly. Obviously, the more frequent you have data, the better you are at seeing trends and driving quality of care. We're now looking at the possibility of a data share house and many new Tableau dashboards that will, again, continue to drive better decision making and improve quality of care for our kiddos.
And I think that data share house concept is one that we evaluated and we knew you'd be able to get to eventually. So it's exciting to see that come down to fruition and get closer in. Also, I think the acceleration of your data delivery to your constituent hospitals is going to be amazing. And I know they're probably really excited to see that move from a quarterly basis to monthly and even faster. So it's really awesome to see that happening. Before we wrap up and move on to kind of question and answers from the audience, how can Technion, we love supporting what CHA does. Is there any way that the audience can help support CHA's mission? Obviously, we all have a buy-in to making sure that children's health is taken care of, and so we'd love to hear how we can all help.
Yeah, thanks for that. Obviously, people can follow our Children's Hospital on our social media, and you can learn about our efforts in communities across the U.S. or communities in your area. We have a lot of resources out there for the public related to COVID-19 as one example, but one that's dear to my heart is asthma education. So always good to have people spread the word on these types of care improvement resources that are at their fingertips. So thanks for letting me share that.
I actually, I love the LinkedIn posts that I see from CHA, and one, there's always some pretty neat facts and tidbits in there, but then also there's some pretty cool data ones as well, where it shows how you're using data on both the policy side and on the clinical side. And so it's really neat to see that being brought together and timely, given the fact that we are in the middle of a pandemic and there was just an election last night. And so I know that y'all work very hard in Washington to advocate. And so I love seeing that. So everybody go follow them on social media. I appreciate everyone joining. I know we've done a couple polls and I think there's a couple questions in queue. So I'm going to turn it over to Rachel to help facilitate that.
Great. Thank you so much, Lori and Will. At this time, if you haven't already done so, please pose your questions in the Q&A panel or in the chat, and we'll address those at this time. One question that we do have is it sometimes hard to show ROI and time to value? What does the exec team think about the progress so far?
Yeah, that's a great question. And that's always foremost in my mind is how do we show our ROI and how do we show it quickly? Again, when we're spending financial investments, we want to show that ROI very quickly. It's a bit challenging, but I would say because we put together the strategy, people could connect to it very easily. And like I said, we spent a lot of time getting the business buy-in, the data owner buy-in. They were excited about it. So it wasn't just coming from IT saying, hey, we need to do this. We need to spend this money to stand up a data warehouse. And trust me, all of these wonderful things are going to happen. So I would say definitely the buy-in. It wasn't just the financial component of it, but it was, we showed how we were going to create more value for our hospitals and how they were going to make better decisions, as well as getting the data to them quicker. So we had some pretty strong, I would say, use cases to share with our executives to get them bought into the vision and the mission. And they're very excited. In fact, it's, can you go faster? So as it always is. So so that's what we're continuing to work on, is how do we get some of this stuff out faster?
Just to add to that, ROI, I find, can be one of the most difficult calculations to really get, because you don't know, you implement something like a data warehouse or a data process, and then all of a sudden you don't know who's picking up the data or where, and it's very hard to collect those use cases where it made an immediate impact. And so the excitement of I want more and more often tells you the value is exponential to what you've put in. But it's really hard to see that. And I know your hospitals have been very excited about the work you've done, and especially bringing in the process in-house. I think you've had some pretty tangible ROI, though, just from a savings standpoint as well.
Well, so that's a very good point. So we didn't realize it going into it, but once we started that initiative, moving the data processing in-house, that was a $2 million savings. So again, we did have some pretty good use cases to get buy-in from our executives to move forward.
That's awesome. And from a little biased plug, we have a webinar on getting buy-in and some time to value in our previous webinar that we did earlier this month, or earlier this year. And so go on Teknion's website and check that out. But yeah, Rachel, any other questions?
Yeah. So another question is, what is one piece of advice you would give anyone trying to start a data journey?
Bring in Technion to help you develop that strategy. I mean, really, there's so many different places to start, that it really helped bringing in somebody that's done this and like I said, tried and true, and can kind of set this up to be successful. And again, you can't always start with the technology. It's really looking at what outcomes are you trying to achieve? What's the use cases that's going to gain the buy-in? So kind of starting there.
Great.
I think that's excellent.
It was kind of easy for us because our technology was kind of dated, so it was a little more of an obvious kind of where we need to start, because technology has changed so much since then. But so everybody's a little bit different.
I think one thing that you did a really good job, Lori, is really listening and not just taking for credit or doing like command and control, but really listening to the undercurrents in your organization and the pulls that certain people had, and validating those and working hard to make sure everybody felt heard and had a chance to be at the table. And I think you did a really good job navigating that, and ultimately I think that benefited the end solution.
Definitely. What is the next big thing you are working on, Lori?
Ooh, the next big thing, it's dashboards, and more dashboards. So we are putting together, and again, Will, thank you for your advice on this, creating kind of a Tableau Center of Excellence. We're calling it a Tableau Hub. Ooh. And kind of, so Tableau isn't just for our analytics or IT, it's for all of CHA. So we're really bringing in people from all the different kind of programs within the organization to stand this up and be creative and think even broader than we are today in how we're presenting data and solving problems for our hospitals.
I'm glad to see the hub gaining traction, and I like that term a lot. Center of excellence can have a connotation from the 90s that it could be bad, and we've all been through poor center of excellence, and if they're not all implemented well. And so I like the term hub, because I think it really says, hey, we're bringing it together, but we're pushing it out as well. And your teams just really come up to speed quickly on Tableau data visualization and how to use data in the right way. And what I love is you take that a step further and you're teaching hospitals how to use that in the clinical setting and in the administrative setting, and really helping push that and evangelize it even further. And thank you for plugging us. I really appreciate that, and the confidence. So thank you.
We have another question. This one is from Dave. Did you have to build a business case to bring in a consultant? Any advice on how you build that case?
Yes, we had to have a business case. There had to be a why behind it. Like I said, the biggest part of the business case was defining those use cases. What are we going to do? Why are we doing this? Why are we spending money on this? Why are we spending money on it now versus later? So again, I really wanted to focus the strategy on not just a big bang. How can we evolve this and grow and show them that we just want to start with this, but we are thinking about the future. So that was a big part in the business case that the executives really appreciated. Was I wasn't looking at it just at a big bang, that I was looking about, here's where we are today, here's the next step, here's where we want to be in the future. So again, it wasn't such a huge hit on the pocketbook from the get-go, but obviously they want it done right. So they also wanted to make sure we were thinking about it in the future. So really laying that out, as well as the business cases. I'm fortunate in that our executives work closely with the hospitals, so they hear a lot of what our hospitals are wanting from us in our data analytics space. So it was kind of easy to get that buy-in of moving in that direction for that purpose.
One thing that I think is very interesting and it really kind of clicked for me is, earlier in this presentation, we talked about what is a strategy, and you had a clear value proposition and you had a unique approach to how you wanted to achieve that. And I think you were willing to make some clear trade-offs. There was things that you were able to deliver today that you're not sure you could deliver at the same level that you were used to, but the trade-offs of what a modern BI system gets you solved that, and you were able to convince people that, hey, it's worth getting on board because it's going to allow us to do X, Y, or Z that we can't do today. But you have to change the way you shift your mindset around that. And you're continually thinking about how to improve on what you're doing, hence how you have implemented the hub from a Tableau visualization standpoint. And so I love how that strategy is continuing just to come together and really push that to the next level.
Great. Another question is, how soon were you able to see the impact of your new strategy?
I mean, really pretty quickly. Obviously, it takes time to implement the technology and get that stood up and get the data formatted into the new environment. But I mean, within the first year, we were seeing benefits, and especially when we went with that initiative to move the data processing in-house. That was, I know it doesn't sound big, but it's a lot of data. The processing, getting unique IDs to line up is really a kind of a tough job in the hospital space because each hospital is very different. So that was a really big and fast win, even though it took us a year to implement. Really considering where we've been in the past, to be able to do that at that level that quickly, our executives were very impressed with.
And just to piggyback on that, I think what was really amazing is the system that you were replacing had been used for like 15 or 20 years, and so it had such a long-standing history. To replace that process in a year, I think it's a monumental achievement. And yeah, I thought that was really cool, and it had such a clear value proposition to it to make sure it is very deadline focused. I know both teams had some late nights getting that across the finish line, but it's really fun to look back and see the success that was created from it.
Great. We'll take a few more questions. One says, what were some of the biggest hurdles you faced with your data transformation? Did your strategy help you overcome them?
Challenges. There's always challenges. I'm not sure the data strategy helped us get through the challenges. I would say the data strategy made sure we thought through most of what our challenges would be. But obviously, when you get into implementation, there's more challenges that you just can't think of that we had to face. Some of that being, we're bringing over this data processing and moving it to monthly. Well, there's a lot of business processes that have to change along with the technology. And so there was some challenges in timing of that. So you've got the technology, and then now we've got to focus on the business process side of it. So there were some challenges there. And then just understanding how our vendor was processing the data, how are we going to process the data and learn from that. There was no documentation to go from. You can't ever predict that in a strategy that you pretty much know going in there's going to be limited documentation, but the fact that it was really, really limited documentation was a pretty big strategy hurdle we had to get over.
And you assigned a really strong project manager from your end to it, and I think they did a
strong is a great word, Will. Yep. Really.
But they did a really good job documenting risks, or ensuring, at least pointing out, oh, I hear this in a meeting, that's a risk, and then chasing down what is, if that comes true, what is the mitigation strategy we're going to use that. And I think that part of execution is very crucial in making sure that you have the right teams, and having strong internal project management to work with the third-party vendors project leadership to ensure that that gets brought to fruition is key. And that person was successful in chasing down the right people on your side that maybe doesn't always have the time to answer or respond to getting the right answers, right? Because everybody's so busy, and if you're not on the core project team, it's not always the core focus. And so
that's very true. And that's a huge challenge, right? You've got an internal team that's still focusing on their day-to-day jobs and maintaining. So you're right. You got to have a great project manager. And in our case, we were lucky. We didn't have just a project manager. We had a project leader and somebody that wasn't afraid to hold people accountable to getting their tasks done on time.
It was a great question.
I think that concludes all the questions for today, but again, if there's a question that we didn't answer, feel free to reach out to us. We'd be happy to share that with both Lori and Will. I'm going to throw up one last poll real quick, and a reminder that this session was recorded, and we will share the recording with you in the next day or so. So if there's anyone on your team that you'd like to share this with, that link will become available in the next day or so. And with that, thank you again, Lori, for your time and sharing your story today, and Will as well. Found this to be a great session, and we hope that you can join us again for our next webinar.
Thank you, Lori.
Thanks, everybody, for joining.
Everybody, thank you.